Good morning. Good morning, and thanks very much for coming. Thank you again for coming. We are thrilled to have everyone here on campus at McGurran Hall. I'd like to introduce myself. My name is Dr. Deborah A. Pellegrino, and I am the Dean of the Panuska College of Professional Studies at the University of Scranton. Panuska College is the home for the undergraduate and graduate programs in health professions, which include nursing, occupational therapy, physical therapy, health administration, and counseling. All of our programs are fully accredited, and the study also includes theory and practice with the broad focus on community service. As Dean, I am proud to say that our graduates become leaders home in the United States, from Scranton to New York City and many other places in the U.S., and in global positions such as Iraq and Tbilisi, Georgia, to name just a few. Progressively, they grow in their fields of expertise and community involvement. Panuska College also houses the Leahy Center and its numerous community programs, including the Leahy Clinic for the Uninsured. Thank you. You will hear our important announcement concerning healthcare education in Northeast Pennsylvania. And now let me tell you who our speakers will be. Dr. Robert Gillis, President and Dean of the Commonwealth Medical College. Dr. Joseph Dreisbach, Interim Associate Provost for Academic Affairs at the University of Scranton. Dr. Raymond Samigo, Associate Dean for Educational Development, the Commonwealth Medical College. And Dr. Daniel West, Chairman, Department of Health Administration and Human Resources in Panuska College and the University of Scranton. Now at this time, it is a pleasure for me to introduce to you Dr. Robert Gillis, President and Dean of the Commonwealth Medical College. Dr. Gillis.
Dean Pellegrino, thank you very much, and thank you all for being here today. And I want to first thank the University of Scranton for hosting this event here in this wonderful setting. This is really a very, very nice setting, and very fitting that it is done here, because many of the students in this program will actually be centered and focused in this facility. Beginning in August 2011, the Commonwealth Medical College and the University of Scranton will offer a dual degree, a Doctor of Medicine and a Master of Health Administration. The goal of the MD-MHA program is to train future physicians for roles as healthcare administrators and leaders in the delivery of healthcare services. The Commonwealth Medical College is committed to working with area colleges and universities to expand educational programs that will enhance and expand career opportunities for our students in this region. The Doctor of Medicine and Master of Health Administration degree program is the very first dual program for TCMC, and also the first for the region, where future physicians can train for roles in management and administration while pursuing a degree to practice medicine. This degree will be one of only 3 degree programs in the country that offer the MD and MHA. This is really a rather remarkable event. The University of South Carolina and Virginia Commonwealth University are the other 2 institutions that offer this degree, so we feel very proud of this. The innovative degree program combines the strengths of 2 existing highly specialized degree programs, the MD and MHA, both of which have been established on the basis of collaboration, service, professional development, and the healthcare needs of our community. The goal of the medical school is to educate a generation of physicians dedicated to lifelong learning and continuously enhancing their skills throughout their careers. The dual degree program is a perfect fit for TCMC, as it focuses on the educational and professional needs of medical students who know early in their careers that they want to pursue health career administration in addition to a medical career. Through this program, medical students can prepare for a career in healthcare and be positioned to take on various leadership roles as healthcare organizations and physicians respond to the dynamic changes in healthcare. This program, this dual degree program, is really very, very appropriate at this time in our nation. As we move into a new generation of healthcare, as we move into a whole new stratum that relates to the way we deliver services in healthcare, this program is very aptly and very appropriately designed. This program will help to ensure that the physicians of the future will actually understand policy and actually be able to make the kinds of adjustments in healthcare that can really meet the needs of the people in our region and in our nation. So we're very proud of this program. We're very proud of what we've been able to do, and we feel especially proud that we're working with the University of Scranton, who in their MHA program is recognized as one of the finest in the country. So it is our privilege to work with the University of Scranton, and we hope that this program will not only interest many of our students, will bring national attention to the region and to both institutions. At this time, I'd like to introduce Dr. Dreisbach, who is the Interim Associate Provost for Academic Affairs in the University of Scranton. And once again, I'd like to thank our colleagues at the University of Scranton for all their hard work in making this program a reality. Thank you.
Thank you, Dr. D'Alessandri. The University of Scranton is equally pleased to be part of this new trend in medical education by being among the first in the nation to collaborate in a dual MD-MHA program. The innovative program builds on the combined strengths and visions shared by the University of Scranton and the TCMC. As a Jesuit university, Scranton provides an education founded on the more than 450-year-old tradition of intellectual rigor and academic excellence and embraces leadership through service. We prepare men and women for others and have a special commitment to serve and educate the people of Northeast Pennsylvania. The university's programs in health professions are well positioned to express this mission. The University of Scranton enjoys an exceptional reputation in the sciences and health professions. More than 50% of the university's students in the sciences, engineering, technology, and mathematics already participate in research. Over the past 10 years, 45% of these students wrote a formal thesis, and more than 1/3 of those students authored or co-authored a publication or conference papers. It's a remarkable record when we compare ourselves to other schools of our type or any type across the country. Of Scranton's 389 senior applicants to medical schools over the last decade, an average of 81% were accepted. And Scranton's graduates make up approximately 10% of TCMC's first class of students. In addition, the University of Scranton pursues and maintains the highest level of accreditation for the programs that we offer. The MHA program provides an excellent example of the best that the university can offer, a highly interactive learning program that integrates teaching, scholarly research, and community service. And under the leadership of Dr. Daniel West, chairperson of the Health Administration Department, and with the support from national grants, teams comprised in part from the faculty of the university have made an historical impact on healthcare management in Slovakia, Georgia, and other countries. The MHA program is nationally accredited by the Commission on Accreditation of Healthcare Management Education, the highest accreditation these programs can have, and holds full graduate membership with the Association of University Programs in Health Administration. So the University of Scranton is pleased to collaborate with TCMC in offering its MHA program as part of the dual MD-MHA degree in order to mutually support the retention of physicians in Northeast Pennsylvania. Now it's my pleasure to introduce Dr. Raymond Smigo, who's Associate Dean for Educational Development at the Commonwealth Medical College.
Good morning. As my colleagues have alluded to, the impetus for the development of this dual degree program in large part is the trends in healthcare around the country and the need for physician leadership and individuals who are knowledgeable not only about clinical medicine but about healthcare management, healthcare organizations, healthcare financing. I'm going to say just a few words about the curriculum of the program. This is designed to be a 5-year course of study, And as such, it adds just one additional year to the typical medical school training. The first 2 years will be largely based upon medical studies, although there'll be a few courses that the students will take in between their first and second year and their second and third year. The third year of the program then is almost exclusively classroom work, coursework that will be based here in the Department of Health Administration. The fourth year is back to medical school, and the students will embark upon their clinical clerkships of medicine, surgery, pediatrics, et cetera. And then the final year of the program, which is typically the fourth year of medical school, will be devoted largely to medical school studies, but there'll be some MHA field work as well. Let me mention that this dual degree program combines not only clinical classroom work, coursework, but also clinical field work in terms of a 1,000-hour health administration residency. The first 500 hours of this residency will be conducted during the final year of the program, the students' fourth year of medical school training, where they typically have up to 6 months of elective time. Probably 3 months of this time will be devoted to field work as part of the MHA residency program. The last 500 hours will be conducted during the students' clinical residency. And we've tried to, very importantly, link the clinical residency to local regional programs that we have, notably the Family Medicine Residency Program at Wyoming Valley, under the auspices of Dr. Rick English, one of our associate deans at TCMC, and the internal medicine residency of the Wright Center for Graduate Medical Education, formerly known as STRP, here in Scranton. The reason behind this linkage is that we want to ensure that students have the best chance of finishing all their clinical training and staying in practice here in our region. Obviously, students that are enrolled in this program will have to satisfy all the admission requirements of both institutions, TCMC and the University of Scranton. At this point, let me turn the program over to Dr. Dan West, Chairman of the Department of Health Administration and Human Resources, and he can give you a little bit more of specifics regarding the MHA curriculum. Thank you.
The continuous changes in healthcare and the complexity of healthcare really requires different leaders for the future. And it's an honor and a privilege to be working with the Commonwealth Medical College in an area that is extremely important and has been so noted. With the physicians and their training, we are hoping that leadership possibilities will continue to expand here in northeastern Pennsylvania for physicians being part of the medical community. We will have physicians that are trained not only to deal with quality of care issues, but we are very interested in having physicians that understand access to care and cost of health care. And I believe that our combined dual program will enable the accomplishment of that. But there's some other interesting opportunities. We believe that this relationship will enable us to pursue grant opportunities to show interdisciplinary cooperation, which is really where the focus is in healthcare and research grants. It will give us an opportunity to teach together in specific courses and to exchange faculties in working together in areas of healthcare. And it will also provide, I think, an opportunity for both institutions to engage in not only evidence-based medicine, but to combine that now with evidence-based management, which is really where the whole future is and where our emphasis is in research and scholarship in health services administration. And finally, I think this opportunity opens up future exploration of global health care. We have an opportunity here to share other research facilities and universities across the world where they're involved in dealing with issues of infectious disease and health management. And again, this dual degree program, I think, just really opens up a lot of opportunities for all of our faculty and all of our students. Thank you very much. Dr. Pellegrini.
At this time, we will sign the Memorandum of Understanding. Dr. D'Alessandri?
Be careful here now, you know, making me nervous, I won't sign it the right way.
Thanks again for coming. I'd also like to recognize in our audience today, we have Dr. Jay Bannon, a trustee of the University of Scranton and an adjunct associate professor at the Commonwealth of Medical College. We have Dr. Jeffrey Welsh, the University's Colleges of Graduate and Continuing Education's dean, and we have Dr. Steve Soldowski. He's the program director of the Masters of Health Administration degree at the University of Scranton. We have Dr. Spinelli, also a faculty member, and many other faculty members and staff of both the Commonwealth Medical College and the University of Scranton. The speakers will be available for interviews. Please see Stan or Ann to arrange it, and have a great day in Scranton.